So we will start with an anterior lateral fibula, because this move is exactly the same as your anterior lateral tibia, except we are now on the fibula. So your listing possibilities for the fibula is anterior lateral or posterior medial. So we'll start with the anterior lateral. Everything is the same as what we've done for your anterior lateral tibia. So you're going to use the leg in between your legs to distract in an S to I direction. You're going to stabilize on the medial side of the knee joint, and your contact point is not on the lateral tibial plateau, but is now on the anterior lateral aspect of the fibula head. So you still use your thenar to anchor in. This can be quite a hard contact to get because it's a lot smaller, but usually if it's moved anterior lateral, it is a little bit more prominent, so you can at least kind of anchor your thenar pad onto the anterior fibula head. However, if it's hard, you may choose to use an activator, and that's fine because you can be really specific with your line of drive with an activator. Stabilization on the medial side of the knee, thenar pad on the anterior portion of the fibula head. Stabilization, distract the leg S to I, and then you're just going to drop straight down A to P. You don't need to worry too much about the L to M, otherwise you kind of push the fibula into the tibia. So you just want to focus on the A to P, and that'll kind of take care of the L to M component of that move. So that's that. For your posterior medial, you'll see in your setup manual that there's two possibilities for this. I'm only going to show you the one that I prefer because I want to cut down your material somewhat before we get back to school so that you're not too overwhelmed. So I'll show you the way that I prefer to do this one, and it's very similar to how you would address a posterior tibia. So we will do that now. If you can flip over onto your tummy. So you want the person to have their knee really close to the edge of the table. So if you can come down, yep, that's good. So that you can get in that position like the posterior tibia, so that you can get in this position and have their foot and their leg resting on your shoulder. So just like the posterior tibia, you want to you can start at 45 and bring up to 90, and then introduce your thrust at this point. So instead of being able to use either hand like you did for the posterior tibia, this one you need to use your outside hand as your contact hand. So you're going to find the posterior aspect of the fibula head. It has shifted posterior and medial for this listing. You can use the finger pad of your third and fourth fingers to hook on to the posterior aspect of the fibula head. Remember that you've got the peroneal nerve there, so you want to be constantly communicating with your person to make sure you're not on it and they're not suffering in silence. So you want to hook on to the posterior aspect of the fibula head. Use your opposite hand as stabilization. You can bring the leg up to 90, and then your line of drive is going to be P to A and M to L, mainly P to A. So the reason you can't use this hand is it's really hard for you to do any M to L with this hand. However, when your outside hand is your contact hand, your elbow is already in this line of drive going P to A, M to L. And so if you are to just thrust P to A, there will be a component of the M to L with it as well. So take your contact, outside hand always, stabilization on top, bring the leg to 90, and then you're just going to kind of feed in and then thrust in the P to A, M to L direction. With the fibula, the other directions that we also did when we motioned the fibula as to which direction it is stuck, we also considered the listing of superior fibula or inferior fibula. And that's when we palpated the fibula head and we dorsiflexed and everted the foot, and we looked for it to go superiorly, and then we plantarflexed and inverted and looked for the fibula head to go inferiorly. So if we are dorsiflexing and everting and it is coming up, but we plantarflex and invert and it's staying superior, that's when we would say we have a superior fibula. So the way that we want to adjust this, I would recommend using a X drop for this one, as it is a lot more comfortable for your person. So what you're going to do is get the person to bend at their knee. Can you bend at your knee? Sorry. And you're going to place their foot on the X drop. So you want them to have actually quite a bended knee so that you can get a lot of S to I in your line of drive. Let's just move this a little bit so you can actually see what I'm doing. So what you want to do here is you are going to hook the fibula. So now we've got a superior fibula. You're going to hook the fibula into the web of your hand and kind of almost run your thumb down the side of the fibula itself. You're also going to contact on the distal part of the leg, where you can imagine the distal part of the fibula is running down and forming the lateral malleolus. So you kind of anchor onto that at the bottom, anchor onto this at the top. You would lift the X drop, making sure that foot's right at the edge of it, and you're basically just going to thrust in an S to I direction straight down the line of the leg in this motion. So the next adjustment is for an inferior fibula. So we are going to take our contact on the inferior aspect of the fibula, which is our lateral malleolus, and we are going to stabilize on the inside of the upper lower leg. So you're kind of just holding the calf. This hand's not really doing anything, it's just stabilization. For this move, we want the foot to be in dorsiflexion and eversion. So we want to prime it into the position that's going to drive the fibula in the superior direction. So you're probably going to need quite a low table for this, because ideally you want to use your body to keep the foot in that dorsiflexion and eversion position. My astrolite table is too high right now and it's way up in my stomach, but ideally it would be a little bit lower down, kind of at your hip or ASIS level, but we'll just go with the flow. So that dorsiflexion and eversion needs to be factored in when you are doing this adjustment. So the contact point for this one is, again, you're going to use the web of your hand, or you're going to, as best as you can, just try and solidify a contact onto the lateral aspect of the inferior fibula. So if you hook on, you can almost pinch on to the inferior aspect of the fibula, that's fine, as long as you've got a sturdy contact that you're not going to fly off as you drive I to S. So you're going to put the foot in that dorsiflex position, use your body to keep it in that direction. You want to get the leg up as high as you can so that you are getting that I to S, but I'm just going to keep it lower because my table is too high. Pop the stabilization hand on the medial side of the inner part of the calf. Hook your hands onto the lateral aspect of the lateral malleolus, stabilization, and you're basically just going to drive straight I to S down the line of the lower leg again.